An all-source intelligence analyst is exactly what the term implies. A national security asset that is deployed as a jack of all trades, but a master of none, to develop a holistic threat picture from a wide array of sources, filtering through volumes of information in multiple disciplines, acquired through overt and covert collection techniques and activities of classified materials, in addition to information available in the open source environment, with the determined objective and purpose to provide national leaders with actionable conclusions to protect American interests, its citizens, and its allies. Trained at a location in Arizona in 1994 to 95, Major Mike Webb is an all-source intelligence analyst. This briefing is not classified at the time. On January 23rd, 2020, employing a phrase that has been hyped repeatedly in the national press, the World Health Organization identified a novel coronavirus that had suddenly and rapidly in the Hubei province, the largest metropolis in the central mainland of communist China, a nation of over 1 billion people. And on January 31st, that nation designated that novel coronavirus, which had begun to spread in devastating effect, to that nation's avowed enemy, the Republic of South Korea, as well as their trade partner since 2016, the Theocratic Republic of Iran, as a public health emergency of international concern. PHEIC. Leaders throughout the world have embraced the Chinese communist model of containment, employing sweeping regulations of commerce and populations through regional and national lockdowns under the title of social distancing to flatten the infection curve of a novel coronavirus that the president has begun to describe as an invisible enemy. It is the job of an all-source intelligence analyst to look at an invisible enemy and make it visible so that it is in no way invincible. If you can see it, you can stop it. In a public statement on April 13th, 2020, Virginia Governor Ralph Northam announced less than a month after the issue of a statewide lockdown order that social distancing appears to be working, based upon projection models that were developed by the Virginia Department of Health. But he frankly admitted that those models were only as good as the numbers, and that the numbers were changing every day. The numbers indeed were changing every day. As a matter of fact, not mere speculation, according to news sources, the first infection case in the Commonwealth of Virginia was reported on March 8, 2020. A U.S. Marine stationed at Fort Belvoir, and the first illnesses date back to February 24, 2020, a fact conceded by the Virginia Department of Health. Moreover, on the date of the order, the case count had climbed to 66, an increase of 330% from the date of first illnesses, and 220% over the first confirmed case in the Commonwealth. And as of this date, when Governor Northam announced that social distancing was working, there were a total of 5,747 confirmed cases, an 870% increase over where the Commonwealth was on the date that social distancing became the law of the land, which for most who took grammar school math is actually a significant increase, especially considering the long lapse between the first reported instances of confirmed cases and the draconian response thereto, which has had associated costs as in other states, where, for instance, unemployment claims in every state have produced the equivalent of a Hurricane Katrina in every state. Yet, according to Governor Ralph Northam, when he looks at the models, social distancing is working. On April 2nd, 2020, Major Mike Webb filed a civil action in the Circuit Court for the City of Alexandria, in part to petition for temporary injunctive relief from irreparable harms to the community of faith in abridgment of their constitutionally guaranteed rights under the Free Exercise Clause of the First Amendment, relying upon the undue burden test recently articulated in Planned Parenthood of Southeastern Pennsylvania v. Casey, a 1992 case heard by the United States Supreme Court and settled law celebrated by many Northern Virginia progressive leaders, including Congressman Don Beyer in the 2016 Supreme Court decision of Whole Woman's Healthcare v. Hellerstedt, striking down public health regulations enacted by the Texas state legislature to ensure a woman's safety when seeking an abortion. The regulations enacted by the Texas legislature included a requirement that an attending physician possess admittance privileges at a hospital within at least 30 miles of the abortion facility where the medical procedure was to be performed, and that facility maintain safety standards at the level equal to that established in the state public health code. But declaring those public health regulations an undue burden that created an obstacle to a woman's access to abortion services, those regulations were declared unconstitutional. In his action, Major Mike Webb challenged the constitutionality of the Northern Order for its generalized assertion that crowds over 10 or more were any less vague than the statutes at issue in the recent Texas abortion case, or the general claims of the curative powers of social distancing, regardless of how therapeutically soothing the term may sound, when in fact just as ineffectual as morning prayer under the current state of the law or Sunday worship. If you can see it, you can stop it. But on April 15th, 2020, the court denied the petition for temporary injunctive relief, concluding, contrary to petitioner's assertion, that no essential nexus nor rational relationship between the proposed regulation and a reasonable expectancy that the measure might directly or proximately affect prevention of infection, the social distancing measures outlined in the governor's order are directly tied to medically sanctioned methods to mitigate the spread of the coronavirus disease. The Alexandria court went further to conclude that the CDC advises all persons to put distance between yourself and other people if COVID-19 is spreading in your community. The CDC also explains what it means by distance, based upon what is known about the novel coronavirus and similar coronaviruses that cause SARS and MERS spread from person to person, happens among close contacts within about 6 feet. Yet, by and through the order of the court, issued on April 15th to thwart the facial constitutional challenge of Executive Order 53, issued by Governor Northam on March 17th, that court, with the cool precision of a surgeon, extracted from CDC guidance only the effective range of infection for the novel coronavirus, in mindful social distancing from the conditions stated expressly immediately below, in which those parameters may apply in infectious spread of a pandemic contagion. Specifically, that this warning guidance is triggered only when, through respiratory droplets produced when an infected person coughs, sneezes, or talks, might be in the direct line of sight trajectory path to enable these infectious droplets to land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Accordingly, in clear abuse of discretion, and only to save the executive order issued beyond the powers of the governor of Virginia, the court deliberately chose to excise those offending parts of national health guidance from those parts it extracted to strike down the facial challenge to the order that has disrupted the economy of the Commonwealth of Virginia, while discriminatorily targeting communities of faith to strip them of their constitutionally guaranteed rights, and also, in consequence, placing the lives of millions of Virginians at risk. According to the unabridged health guidance published by the CDC, as of April 13th, some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms, but absent an infected person asymptomatically coughing or sneezing. CDC has published no guidance on exactly how that method of infection, distinct from a fully incubated infection, may occur, nor has Governor Northam nor the Virginia Department of Health, nor can they explain, because in the history of virology, dating back to the late 19th century, there is only a limited range of ways in which a viral infection can occur. And unless a viral contagion that emerged in communist China, which already has distinct offensive tactical capabilities, just happened to develop a new means of transmitting infection by the random process of evolution, there is no scientific precedent for a viral contagion that causes a person to radiate infectious spread through the pores of their skin, lower abdominal emanations, or gaseous releases through any other opening of the human body. Major Mike Webb has provided notice to the Circuit Court and the Governor of Virginia of his petition for appeal to the Virginia Supreme Court, and intends to request emergency discovery to compel the governor and the Virginia Department of Health to produce immediately credible evidence regarding exactly how infectious powers arise when more than 10 or more persons are gathered in a social setting, regardless of the size of the venue. Exactly how, within 6 feet of a person but outside the direct line of sight trajectory, might be vulnerable to an infectious agent being propelled into the entrances of their respiratory tract, and exactly how an asymptomatic infection might be transmitted from one person to another in absence of an event involving a cough or a sneeze. If you can see it, you can stop it. Yet far more concerning than the decision of the court to address specific preliminary parameters in which the 6-foot engagement area might apply is the court's total avoidance of the CDC guidance that specifically provides for the means by which what is called an indirect infection might occur. That is, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly eyes. And it is known that a person unconsciously touches their face at least 3,000 times per day. While the Chinese government has also been reluctant to provide details, some of their scientists have reported rare cases of COVID-19 incident-related conjunctivitis, or contact of the hands infected, and then touching the eyes. And although despite traces of viable samples found aboard the Princess Diamond cruise ship by CDC researchers, persisting in viability without a human host on an inanimate surface, amazingly remaining viable for periods as long as at least 11 days. The CDC states that they have not yet conclusively determined that this is a main way in which the virus spreads, relying on the wholly novel theory of asymptomatic infection. But they still encourage, beyond dubious guidance, that a do-it-yourself medical mask might somehow be impervious to penetration by subcellular biological particles, causing a rash of panicked local governments and citizens to mandate the wearing of face coverings in public. They yet have tried to encourage persons to wash their hands, often with soap and water, and if soap and water are not available, to use alcohol-based hand rub. And further encourage that a person routinely clean frequently surfaces that are touched by the human hands. Yet these indirect infections by contact with contaminated surfaces viable for at least 11 days suggest that the plausible reason as to why infection continued to rise after quarantine protocols were initiated aboard the Princess Diamond cruise line, but fail to explain why American passengers, despite being in the small minority of persons aboard an ocean liner departing from Japan, might find, after immediate quarantine, a higher than average incidence of infection than any other passenger or crew member aboard that ship. A tactically significant fact that, together with other validated intelligence, tends to suggest that this pathogen or novel coronavirus has been weaponized and is being deployed in line with tactical and strategic considerations by an enemy of the United States and its interests around the world, and operating in the absence of that consideration places all American lives at risk. If you can see it, you can stop it. A trained all-source intelligence analyst is a jack of all trades and a master of none, but he knows just enough to be dangerous. My name is Major Mike M., and I am running for U.S. Congress with liberty, honor, and excellence. By God, we shall make America great again. Honest. This advertisement was authorized by Mike Webb.